Hi, this is Dr. Steve Vargo with another episode of Can I Ask You One Question, where we try to find industry experts and high performers and try to learn one thing from them that we can immediately apply to our professional, maybe even our personal lives. So I have with me here today Dr. Rick Peterson, and Dr. Peterson owns 3 practices in the Chicago area. He specializes in binocular vision and focusing disorders. And one of the treatment options that he offers his patients is neurolens. So great to have you here, Rick.
Thanks, Steve. I appreciate the invitation and look forward to sharing some thoughts. These are enjoyable spots that you do, and I think doctors are recognizing the benefit to their practices.
Thank you. I appreciate that. Great to have you here. Rick, as we were just talking before, one of the things that I hear from a lot of ODs is that they'll invest in some kind of technology. Oftentimes it's some kind of specialized technology, might be an expensive investment for the practice. And one of the struggles that they'll have is getting patients to buy in. And I think sometimes what we see is what I like to call a healthy skepticism from patients. So I don't think it's from a lack of trust with the doctor, but I think it's just the way we're wired up. Patient sits down, doctor starts talking about some kind of new service or some kind of new technology that they haven't heard about before. And the patient's minds go to, do I really need this? Or how come my last doctor didn't mention this? Or how much is this going to cost? So my question to you, when presenting neurolens to patients and you sense that skepticism, and you have to bridge that gap, how do you help patients overcome that skepticism that they may have about what they're hearing?
That's a great question, and I think a question that a lot of us on the streets are really asking. How do we have an impact on people's lives, and how do we get them to buy into that technology? And I think neurolens is a great example. Let me go through kind of what we do in the offices and then let you know how neurolens is actually a great example of this.
Mm-hmm.
So to answer the question, I would say the most important component is education, excitement, and then adding an ambassador in your offices. So when you find a new technology or something that truly can have an impact in your world and in your life, be it financially, be it patient experience, it's about helping the patient understand. So let's start with education. Looking at the education side, it's important to uncover the problem that the patient didn't know they had, right? A patient comes in and says, I have a headache. Great, we know there's a headache, we fix it. But the art of optometry, as I like to teach, is teaching the patient about the problem they didn't know they have. Then number 2 is demonstrate that problem. So under education, we've got uncover and now demonstrate it, using tools like your old modified Dorrington, red-green glasses, using a way to help the patient understand what they're doing and or how they're compensating. For example, with a child, we'll do modified Dorrington. Okay, do you see the white dot? Yes. Do you see the red line? Yeah. Where is the red line? Well, Dr. Rick, the red line is to the right. So we say, you know what? In a perfect world, if your right eye sees the red line and your left eye sees the white dot, guess how they should look? And you always lead a child by bringing it together. And the child says, Dr. Rick, they should be touchy. Exactly. So I wear glasses and I'll make a joke just to be able to see somebody. So when I'm talking to them, but you're going to wear glasses to help your eyes work together. So getting that buy-in is one of the most important components. And then stories to help them understand that you get it. So for example, when you're dealing with a child who has a focusing problem, they may not really understand it. So you say, it's kind of like wearing your shoes on the wrong feet. If you're wearing your shoes on the wrong feet, you could walk okay. It will feel a little weird, but you can walk okay. But if you're running, your feet are going to feel weird and not work together. And that's the best way to describe your eyes.
Yeah, I love the idea of education combined with excitement, because I think education is extremely important, but it has its limitations as well. I think we lean really heavily on educating and providing information, but when you look at the science and kind of nerd out on the research and psychology, you realize that so many of our decisions are made around emotion more than logic. We're not very logical as human beings. We're more biological. So creating that excitement, I think, is a big component. And then I love those visuals as well, because being able to demonstrate that I think it really helps people get there in their mind as to what this is.
Absolutely. And I feel that helping them understand that you understand their problem helps close that. So now the patient, so you say, hey, here's what's going on. Here's how you're adjusting. Hey, we've got these pair of glasses that will help you see better, help your eyes work together better, kind of like putting your shoes on the right feet. Then when you're calling the staff in to continue the experience in the office and purchase the glasses, you get someone who's got an excitement in there. So maybe a staff member whose family member or themselves have been touched by, in this case, the neurolens, and then they can carry it out and make it exciting. To keep that excitement going, you want to also create the options for the patient. You know, it is a more expensive lens in the case of neurolens, so we want to show, one, what is the value of that lens, and two, here's a payment plan. Here's ways to make it more affordable for you so that you can take this new technology and have it help your child or help yourself. Because really, binocular vision is the other component. Is binocular vision isn't a child thing, right? It's important to make sure both eyes see well independently. But to me, it's equally as important to make sure the eyes are focusing together. I use Prism almost every day in different prescriptions.
So, one last follow-up question here. In your experience, in your practice, do you find that this is something that if someone is going to invest into neurolens, that they're going to do it that day? Or is it a matter of planting the seed and they come back later, maybe a little bit more knowledgeable, they've done some of their own research, or is it a mix of both?
I think it's a mix, but I think the safer you make it. So for example, we started by putting half down at first and then allowing payments. And then neurolens, again, is a great example because there's a 100% guarantee on that lens, no strings attached. And so when patients feel safer, you're addressing their problem and you've made it a very safe investment for them.
Great. Awesome. Well, thank you so much, Rick. I told you this would be quick. Can I ask you one question? So a couple follow-ups, but really appreciate it. I think it's an important discussion to have because I do see more and more doctors wanting to expand their services, expand the products they offer, but getting hung up a little bit, I think, on the communication side. And what I tend to see pretty routinely is doctors that tend to be more successful in these areas when they want to branch out. So much of it comes back to the ability to effectively communicate. One of those areas is helping people, I think, overcome their own skepticism about some things they're hearing. So really appreciate your insight on this.
Thank you, Steve. You know, neurolens does a great job in carrying that because it gives you the survey that helps uncover it. It gives you a device that helps you objectively measure it. Then it offers ways to show the patient, here's how your eyes are working together. And then it gives you a product to fix it. So look at that. Everything you've talked about wrapped together in one product. So yeah, how you follow that, I think, is extremely important. Thank you very much for asking me to be on today.
Great, thank you. And yeah, it is impressive technology. IDOC got interested in neurolens a while back, and we mostly got interested not directly from them, but we started hearing from other doctors and the success that they were having in their practices with it, with the patients they were treating. So I'll link, if I can, the website in the comments. But thanks again. Have a great day.